everyone, I'm Dr. Shruti Reddy, consultant gynecologist, Treatment Range Hospital. What is premenstrual syndrome? Many a time, this condition is usually not taken seriously by many women and not recognized by physician and not treated well. So what is premenstrual syndrome? It's a behavioral, emotional and physical discomfort which is seen just before menses. When do the symptoms appear for a woman who is suffering from premenstrual syndrome? Women who is having premenstrual syndrome, usually they develop symptoms in the second half of cycle or 1 week just before the menses. So 80% of the women will have premenstrual syndrome or they experience premenstrual syndrome at one point of time. But the severity may vary from person to person. Like in 50% of the women, the symptoms will be mild, and in 20% the symptoms are severe, and in 2 to 5% the symptoms are very severe, and that condition is labeled as premenstrual dysphoric syndrome. So what are the symptoms we usually expect in a woman who is suffering from premenstrual syndrome? It has two types of symptoms: psychological symptoms and physical symptoms. And what are the psychological symptoms? Usually women will have irritability and decreased concentration in any type of work, and they are unable to engage in their work properly, and restlessness, anger, social withdrawal. These are the psychological symptoms. And what are the physical symptoms? And they usually have body pains, joint pains, headache, bloating sensation, vomitings, nausea, and increased body weight due to more water retention. The exact etiology of premenstrual syndrome is not detected so far, but few literatures implicate that there might be some interaction between the hormones like estrogen and progesterone released from the ovary and the dopamine and serotonin released from the brain. And how do we diagnose? Unfortunately, there is no clear-cut imaging test or blood test to diagnose this condition. The diagnosis is completely based on symptoms. So the patient has to clearly notify the symptoms to the doctor so that the doctor can come to a conclusion and the condition can be managed very well. What is the treatment? For the woman who is suffering from mild symptoms, small changes in the diet and lifestyle may help in relieving the mild symptoms. So what are the dietary and lifestyle modifications? So woman has to take diet rich in vegetables, leafy vegetables, cereals, pulses. Apart from that, the diet should contain foods rich in folic acid, which is easily available in broccoli and spinach, and vitamin B6, which is also otherwise called pyridoxine, which can be obtained from bananas and eggs, and also diet rich in calcium like sesame seeds and almonds. And magnesium helps in relieving joint pains and muscle cramps, which is abundantly available in bananas. So this type of modifications may bring down the symptoms to a little extent. Apart from this diet modifications, women should have exercise, because exercise helps in releasing a serotonin hormone, which is also called happy hormone. So for the mild symptoms, these are the modifications to be made. And for the severe symptoms, apart from dietary and lifestyle modifications, they may need few painkillers so that they can be relieved from muscle cramps, joint pains or body pains. And women who is suffering from premenstrual dysphoric syndrome, apart from these medications and dietary and lifestyle modifications, they also need psychiatric consultation so that antidepressants can be prescribed. In conclusion, premenstrual syndrome is usually neglected. It does exist and it can be managed if it is diagnosed properly, and it can be treated well. Thank you.